Hi everyone, my name is Daniel from Hardy, and for this information, I will talk about tobacco. So first, what is tobacco? Tobacco is a plant grown for its leaves, which are dried and fermented before being put in tobacco products. Tobacco contains nicotine, a chemical that's highly addictive and can lead to addiction, which is why it's difficult to quit from tobacco. Tobacco smoke contains more than 7,000 chemicals, at least 70 of which are known to cause cancer. Tobacco that is not burned is called smokeless tobacco. With including nicotine, there are at least 30 chemicals in smokeless tobacco that are known to cause cancer. How does tobacco affect our bodies? Nicotine in any tobacco product readily absorbs into the blood when a person uses it. Upon entering the blood, nicotine immediately stimulates the adrenal glands to release hormone epinephrine, which is your adrenaline. Epinephrine then stimulates the central nervous system and increases blood pressure, breathing, and heart rate. As with other addictive drugs such as cocaine and heroin, nicotine activates the brain's reward circuits and releases dopamine in the brain, which reinforce rewarding behaviors. Studies suggest that other chemicals in tobacco smoke, such as acetaldehyde, may enhance nicotine's effect on the brain. There are many health risks from smoking and using tobacco, such as heart and blood vessel problems. Tobacco use can cause blood vessels in the brain to weaken and build up blood clots, which can lead to stroke. It can lead to coronary artery disease, including angina and heart attack. Reduced blood supply to the legs, problems with erections or impotency for the males because of decreased blood flow into the penis. Using tobacco can also lead to cancer, more likely to be in the lung, mouth, larynx, nose, and sinuses, throat, esophagus, and stomach. Lung problems such as chronic obstructive pulmonary disease or asthma that is harder to control. Pregnant women who smoke cigarettes run an increase of miscarriage, stillborn or premature infants, or infants with low birth weight. Smoking while pregnant may also be associated with learning and behavioral problems in exposed children. Smokers who switch to smokeless tobacco instead of quitting still have health risks. They have increased risk of cancer of the mouth, tongue, esophagus, and pancreas. They're also susceptible to gum problems, tooth wear, and cavities, worsening head blisters and angina. Those who are often around the smoke of others have higher risk of heart attack and heart disease, lung cancer, and sudden severe reactions including of the eye, nose, throat, and lower respiratory tract. Infants and children who are often exposed to secondhand smoke are at risk of asthma, lung damage, and poor lung function, and it can even cause death with sudden infant death syndrome. Children with asthma who live with a smoker are most likely to visit the emergency room. Quitting tobacco is difficult, especially if you are doing it alone. Both behavioral treatments and medication can help people quit smoking, but the combination of medication with counseling is more effective than either alone. In order to quit tobacco, you should seek support from family members, friends, and coworkers. Talk to your healthcare provider about nicotine replacement therapy and smoking cessation medicines. Nicotine replacement therapies were the first medications the U.S. Food and Drug Administration approved for use in smoking cessation therapy. Join a smoking cessation program that are offered by hospitals, health departments, community centers, and work sites.